How frequently do you discuss clinical trials with your MDS patients? Are there any current trials that you're discussing at the moment that are particularly interesting or promising?
Well, we are a major centre for MDS research, and we have been for a long time. So we're very focused on clinical trials here in Leeds. Um, Most of our patients are suitable for at least a registry clinical trial, and the registry is essentially an opportunity to collect information about every patient's type of MDS, and to use that information then going forward and document the information about how those patients' MDS develops and what sort of treatment they have and what sort of response to treatment. So that is a trial, a registry trial, a prospective registry, and this is becoming really very important to generate data that we can call real world data or community based data. That is, to record the information about patients who are not in clinical trials of new drugs, but are nevertheless managed using conventional treatments. And we need to know what the outcome for patients in day to day practice is so that we can make a comparison between that and treatments that are developed in therapeutic trials. MDS is not a disease that is high up in the conscience of the pharmaceutical industry. However, there are a modicum of drugs that are being tested in clinical trials, and there is increasing interest particularly because of MDS in the high risk setting and its parallels with acute myeloid leukemia. So there are many trials in that space now, and where they're available, we would consider patients for them. The problem is that many of the patients are just not suitable for clinical trials because the trial protocol specifies what type of patient needs to go into the trial, and very often that doesn't exactly match the patient that's sitting in front of you. So we have to be careful to match the trial to the patient, and then we would discuss trials in detail with them. But where they are available, we usually have the clinical trials available in Leeds, and we would usually ask patients to participate if they wish to.